The heart normally beats between 60 and 100 times per minute when resting. When it exceeds 100 beats per minute without any physical activity, this condition is known as tachycardia. A faster pulse can happen during stress, exercise, or excitement, which is completely normal as the body needs to deliver more oxygen to muscles and organs. However, if the pulse stays above 100 while at rest, it might indicate that the cardiovascular system is under strain. The heart functions as a pump, circulating blood and providing oxygen and nutrients to the brain and muscles. While occasional episodes of increased heart rate may not be harmful, persistent tachycardia can put extra stress on the heart muscle. Understanding the reasons behind an elevated heart rate is crucial for determining if it's harmless or a sign of a more serious issue. The heart rate is controlled by the body's nervous system. Two main systems regulate it: the sympathetic nervous system, which speeds the heart up, and the parasympathetic nervous system, which slows it down. When a person experiences stress, anxiety, or physical exertion, the sympathetic system releases hormones such as adrenaline. These hormones signal the heart to beat faster so the body can respond quickly. However, sometimes the heart continues beating quickly even when the body is resting. This may happen for several reasons. Dehydration, fever, anemia, or hormonal changes can all increase heart rate. The body may attempt to compensate for a lack of oxygen or reduced blood volume by increasing the speed of the heart's pumping action. Stimulants such as caffeine, nicotine, and certain medications may also increase pulse rate. When these factors are temporary, the heart rate usually returns to normal once the trigger disappears. But when tachycardia persists without a clear reason, further evaluation may be necessary. When the heart beats too fast for too long, it struggles to relax between beats, leading to less efficient pumping. Normally, the heart fills with blood during its relaxation phase, but a high heart rate shortens this phase, causing each beat to pump less blood. To keep up, the heart may speed up further, creating a cycle of strain that can weaken its function. This persistent tachycardia also increases the heart's oxygen demand, which can lead to chest discomfort or fatigue if the coronary arteries can't keep up. Therefore, monitoring heart rhythm is crucial to determine if tachycardia is temporary or requires medical attention. Not every episode of a fast heart rate is dangerous. After exercise or emotional stress, it's normal for the heart rate to rise temporarily. However, when tachycardia appears without clear reason and persists, it becomes more concerning. A resting pulse consistently above 100 may indicate unnecessary strain on the heart. Over time, this strain can lead to complications. Another warning sign is tachycardia, accompanied by symptoms like dizziness or chest discomfort, suggesting inefficient oxygen delivery. Certain types of tachycardia stem from electrical system abnormalities in the heart, requiring medical evaluation. Understanding the distinction between temporary increases in heart rate and persistent tachycardia is crucial for determining if the condition is harmless or potentially dangerous. A resting pulse above 100 can indicate various underlying conditions. One common cause is anemia, where the blood carries less oxygen, prompting the heart to beat faster to deliver more oxygen to the body's tissues. Another factor could be an overactive thyroid gland. This condition results in excess hormones that speed up metabolism, which can also lead to an increased heart rate due to heightened sensitivity to adrenaline. Dehydration is another reason for a faster pulse. When the body lacks sufficient fluids, blood volume decreases, causing the heart to pump faster to maintain circulation. Certain medications, especially stimulants like caffeine and nicotine, can raise the pulse rate. These substances stimulate the nervous system and may trigger tachycardia. Lastly, emotional stress can significantly impact heart rate. Chronic anxiety keeps the body in a state of heightened alertness, which can elevate the resting heart rate. Identifying these causes is crucial for effective treatment of tachycardia. Persistent tachycardia puts a lot of stress on the cardiovascular system, leading to fatigue and reduced exercise tolerance. When the heart beats rapidly, it uses more oxygen and energy, which can wear the body down. The shortened relaxation phase between beats reduces circulation efficiency, causing feelings of weakness. Over time, this chronic condition can even affect the heart's structure, potentially leading to tachycardia-induced cardiomyopathy. Thankfully, treating the underlying rhythm issue often helps the heart return to normal function. This highlights the importance of early recognition and monitoring of persistent tachycardia to prevent serious complications. The heart is closely linked to how our body responds to stress. When we face danger or pressure, our brain triggers the release of hormones like adrenaline and cortisol. These hormones prepare us for action by boosting our heart rate and blood pressure. While this response is helpful in short bursts, chronic stress can keep our hearts constantly stimulated. The nervous system may send signals that keep our heart racing, which isn't good for long-term health. Hormonal conditions, like an overactive thyroid, can also increase heart rate. Additionally, emotional stress from anxiety or panic attacks can cause sudden spikes in heart rate. Understanding these responses helps explain why our heart can race even when we're at rest. Occasional heart rate increases are normal, but consistent resting pulses over 100 beats per minute can signal cardiovascular strain. If tachycardia occurs with symptoms like chest pain, shortness of breath, or dizziness, seek medical attention. Sudden changes in heart rate patterns, especially after having a normal pulse, may indicate new health issues. Monitoring heart rate can help identify these changes, and doctors often use electrocardiograms or wearable devices for analysis. Early recognition of these signs is crucial for preventing complications and ensuring heart health. When someone has a resting heart rate consistently above 100 beats per minute, it's time for a thorough evaluation by a doctor. The initial step usually involves measuring the heart rate and blood pressure while the person is at rest, but this single measurement might not give the full picture. Heart rhythms can fluctuate throughout the day due to various factors like physical activity, stress, and even sleep patterns. So doctors often turn to electrocardiography, known as an ECG, to get more detailed information. An ECG captures the heart's electrical activity and can help spot any irregular rhythms. But if tachycardia only happens sporadically, it might not show up in a brief ECG recording. In such cases, doctors might suggest using a Holter monitor, a small device that continuously records heart rhythms for 24 hours or more, which can reveal patterns that otherwise might go unnoticed. Your heart is always working, beating thousands of times daily to keep you alive. It delivers essential oxygen and nutrients to every part of your body, yet we often take it for granted. Sometimes, though, your heart may send signals that something's off. A resting pulse over 100 beats per minute can be a natural response to stress or dehydration. But if you notice a consistently fast pulse without a clear cause, it might indicate that your cardiovascular system is under strain. It's vital to pay attention to these signals without panicking. Monitoring your heart rate can help catch potential issues early. Simple lifestyle changes like regular pulse checks, getting enough sleep, managing stress, and cutting back on stimulants can support your heart's health. If your pulse stays high, or if you experience dizziness, chest discomfort, or shortness of breath, it's time to seek medical advice. Your heart often communicates subtle messages, and understanding them is key to maintaining your health. Listening to your heart can lead to better long-term wellness. During sleep, many people experience a natural slowing of their heart rate as their body enters a recovery phase. This is when the nervous system relaxes, breathing deepens, and the heart beats more slowly. However, some individuals may notice their heart suddenly racing at night, a condition known as nighttime tachycardia. This can lead to waking up with a racing heart or a pounding sensation in the chest. Several factors can trigger this nighttime heart racing. Common culprits include sleep disturbances, anxiety, and hormonal changes that activate the nervous system during sleep. Additionally, sleep apnea is a significant cause of increased heart rates at night. This condition causes breathing to temporarily stop during sleep, leading to drops in oxygen levels in the blood. When oxygen levels drop, the body releases stress hormones, which can increase heart rate and blood pressure. Repeated episodes of sleep apnea can lead to sudden increases in heart rate, especially during the night. Over time, if left untreated, sleep apnea may contribute to persistent tachycardia and increased cardiovascular stress. Recognizing the symptoms of nighttime tachycardia is crucial, as they may indicate underlying heart problems. If you experience these symptoms, it's important to consult a healthcare professional to explore potential causes and solutions. Taking these steps can help ensure better heart health and improve overall sleep quality. Measuring your pulse is a great way to get insights into your heart health. To check your pulse, find a quiet spot and place 2 fingers on the inner wrist below the thumb. Count the beats for 30 seconds and multiply by 2 to get your heart rate. It's best to do this when you are resting to avoid any temporary spikes from activity or stress. For consistency, try measuring your pulse at the same time each day, like first thing in the morning. This can help you spot any changes over time. Many people use fitness trackers for this purpose, which can show trends, even if they aren't always perfectly accurate. If your resting pulse is consistently over 100 beats per minute, consider consulting a healthcare professional. Not all tachycardia requires medical treatment. In many instances, it's a temporary condition caused by factors like dehydration, stress, or stimulants. When you address the underlying cause, your heart rate often goes back to normal. However, if tachycardia persists, causes symptoms, or is linked to a heart rhythm disorder, treatment may be necessary. Doctors often suggest lifestyle changes as a first step. Reducing caffeine intake, improving sleep quality, managing stress, and staying hydrated can significantly help in regulating your heart rate. Additionally, regular physical activity enhances cardiovascular efficiency, which can lower your resting pulse over time. In some cases, medications may be prescribed to manage heart rhythm or slow down the heart rate. These medications work by stabilizing the electrical activity in the heart and decreasing excessive stimulation. If a specific rhythm disorder triggers tachycardia, more specialized treatments like catheter ablation might be explored. The primary goal of any treatment is to restore a stable heart rhythm while minimizing stress on your cardiovascular system. Early evaluation by a healthcare professional is crucial to determine the most suitable treatment plan for each individual case.